Today, the claim I'm going to respond to is cosmetic surgery, and my opponent claims is that cosmetic surgery affects your health, and number two, cosmetic surgery affects you psychologically. And to respond to these claims, it is undeniable that cosmetic surgery does affect one's health after the procedure. Yes, cosmetic surgery affects a person mentally after the procedure. However, cosmetic surgery is sometimes needed rather than a want. Cosmetic surgery can also be beneficial for people mentally so that their mental health could actually be better. And so I'll go back to my opponent's first claim that cosmetic surgery affects your health. The original claim said that anyone who is undergoing surgery is at risk to serious side effects that can result from the surgery and effects on one's health. And here my opponent cited the list, the side effects of blood clot, blood loss, brain damage, and then pretty much what could result from surgery. And I challenge this by saying that these surgical procedures are continually improving by many practices and tests, so that the difficulties that result afterwards are minimal. If it was not so, if there was such common side effects reoccurring, then cosmetic surgery would not be so appealing to the people. There were over 10 million surgical and non-surgical cosmetic procedures performed in the U.S. in 2008, as reported by the American Society for Aesthetic Plastic Surgery. Surgical procedures accounted for 17% of the total, with non-surgical procedures making up 83% of the total. Licensed professional plastic surgeons go through rigorous training and must pass through various qualifications. Researching about the health risks for plastic surgery, according to the American Society of Plastic Surgeons, ASPS, all of their surgeons must be able to conduct procedures such as any other medical surgeon and then be qualified after 6 to 7 more years of cosmetic surgery. By going to a highly qualified surgeon, post-side effects are decreased significantly. The American Society of Plastic Surgeons is the largest organization of board-certified plastic surgeons in the world, representing more than 6,700 physician members. The society is recognized as a leading authority in cosmetic and reconstructive plastic surgery. ASPS is made up of more than 94% of all board-certified plastic surgeons in the United States. Sometimes, due to one's health, plastic surgery is used in these cases to improve one's symptoms. For instance, migraine headache sufferers get significant relief or elimination of symptoms through modifications of plastic surgery procedures traditionally used to minimize facial wrinkles, reports the June issue of Plastic and Reconstructive Surgery, the official medical journal of the American Society of Plastic Surgeons. Quote, in a study of 29 patients conducted by board-certified plastic surgeons, here it pretty much says, she's explaining how by removing the vertical frown muscles, which is considered a plastic surgery, the migraine symptoms during an average follow-up period after has been eliminated. A small branch of the trigeminal nerve, a large cranial nerve located near the temple, essential for chewing and sensibility of the face, was also detached during surgery. So, my opponent's second claim was that the cosmetic surgery affects you psychologically. And while post-surgery can become a huge mental impact for the person that received the surgery, the results of the patient have higher levels of confidence and esteem. In regards to a clinical assistant professor at University of Florida College of Nursing, Figueroa has said that many individuals, including healthcare providers, have preconceived negative ideas without fully understanding the benefits that may occur from these procedures. While cases such as body dysmorphic disorder can be found in patients who are never satisfied with their appearance, Figueroa has also stated that many licensed surgeons would first see to it that the patient is psychologically ready and prepared with what might happen after the surgery, and to always reaffirm that surgery is not only a means to have a better lifestyle. So in conclusion, cosmetic surgery is not to be seen as a one fix towards a dramatic improvement of one's lifestyle, and that the person should always have a realistic goal when considering changing his or her appearance. Thank you.
All right, you labeled the topic but not the proposition. You did signal what the supporting points were pretty clearly. It sounds like you've got to challenge the criteria that you're presenting as you get to the first point, but there's no development on that criteria. The signposting on the health issue was pretty clear. You point out and summarize what the advocate's claim are, and you're trying to diminish the importance of that claim by suggesting that the risk is being reduced because of the qualifications of the surgeons. And I think that's a good strategy. One thing that's missing here is, however, the notion about did the advocate provide any substance to the risks? I mean, all the things that you listed, for instance, as risks in your summary of what the advocate was talking about, aren't those the same kinds of risks that you face when you're getting your teeth pulled or when you're having any kind of surgery, not just plastic surgery, or excuse me, cosmetic surgery? And what's the frequency with which those kinds of hazards occur? We don't get anything. Just because there's a hazard of something occurring doesn't necessarily mean that it's likely or probable, or it's more likely or more probable under the circumstances of cosmetic surgery. I thought you were going to get to that point when you mentioned that we have 10 million surgeries being performed each year. I think that's a solid piece of information, but we don't get any comparative data about the risks. And so I thought that you missed a trick here analyzing the advocate's evidence on that particular point. I do like the attempt, though, to satisfy our need for some control on that by talking about how qualified the physicians are and how authoritative the group is. Then there's some discussion about what the need for surgery is and what the potential examples are, and I thought that was basically okay. It does establish that there is some reason for doing those kinds of things, although I don't remember the advocate suggesting that people are doing this for no reason whatsoever. I'm not sure how much overlap there is between your argument and the one that was presented by the advocate. The transition to the second point was pretty clear. You've got a counterclaim on potential issues, and again, you're back to advantages, but you need some data to minimize, for instance, that one big issue that you talk about where the patients are out of control, they continuously seek surgery. How infrequent is that? If we had some data on that, that would make it seem a lot less significant. Okay, thank you.